So I'm from southeastern Massachusetts, so about 45 minutes from Boston. And I originally chose URI because it was a pretty good distance to my home, not too far away, a little over an hour, hour and a half, so I could see my family. And it had the best of both worlds. So it allowed me to not only go into the pharmacy world and the strong academic program at URI, but at the same time, it also had other programs as well. So I really love sports and I love interacting with other majors. So it had a combination of all those factors, and can't really beat it when it's right next to the beach either. So it's definitely a nice perk.
Yeah, being next to the beach was one of my perks as well. I wish I was an hour and a half away. I'm actually from Dubai, UAE, so it was a long flight, but yeah, sort of similar reasons. I love the pharmacy program. And then when did you graduate?
So I graduated in 2018.
Okay, so pretty recent. And what has been your journey like after graduation?
So I took a pretty non-traditional path. So I graduated in 2018, and even during school, I'd been working in retail pharmacy for a couple of years. So I began working for a couple of years, and right after school, I graduated and took a job in retail pharmacy full time. Paid off a lot of my student loans, and at the time, I really wasn't exactly sure of what I wanted to do like after graduation. So I definitely felt more comfortable in the retail setting and wanted to go that route initially. And then after a year about working in retail setting, I decided to apply for some residencies. And I ended up fortunately matching with a PGY-1 at the Providence VA in Providence, Rhode Island. And then after that, I did a PGY2 in pain management and palliative care here at UF Health in Jacksonville, Florida.
Oh, nice. So before we get into what each of those residencies were like, I just want to ask, what was the path like moving from retail to residency rather than getting a residency directly after graduating? Do you feel like it made a difference?
Yeah, so that's a good question. And I think it's really important to address that because I get this asked quite a bit from a lot of students that are like always getting the pressure almost to have to go into residency right away. You can definitely, I would say to the person that's like asking that question, how committed are you for a residency right after school? And if you're not fully committed, like 100%, and you're still pretty unsure of what you want to do, it's okay to do retail for a couple of years and like really understand. And like, I enjoy retail and I still do it part time. So I really enjoy those patient interactions. And at the time, I wasn't fully sure that I wanted to go into a more clinical setting and like see and get those interactions and recommit myself to learning more because once you go back into residency, it's quite a learning process. You're really going back into school and like hitting the books hard and like doing topic discussions and projects. And it's a lot of outside work that I think a lot of people need to take into account. So it's definitely not impossible. I would say if someone's going to go from a couple of years in like the retail setting and jump back into a residency, just make sure you're staying connected with all your professors and the people you're on rotations with too. I was really fortunate to speak with Dr. LaPlante and Dr. Ward and Dr. Charpentier at URI, really just asking them like, hey, this is my scenario presently. I know you guys, I was on rotation with a lot of them and did a lot of research. So I was fortunate to be able to reconnect with those professors that wrote some awesome letters of recommendation for me. So that's a big challenge too, that you need to just think about getting letters of rec for people that remember what you did maybe a couple of years down the road, because it's not so easy to find that.
Yeah, I'm learning that as I go along is, keep your professors close. And we do have a really great staff here at URI. Our faculty is awesome. So that's helpful to know. So why exactly, after a year, you said you're working in retail, why exactly after that were you like, okay, now I think is the time I'm ready for residency?
Yeah, so where I worked in retail, I worked in a couple different areas in Massachusetts where substance use disorder and chronic pain is very prevalent, as it is across much of the country in America and across the world. But really, what I saw we had a lot of Suboxone clinics around where we were working, and I was getting a lot of really good patient interactions, like trying to help these patients, whether with clean needles, naloxone training, and just general counseling for opioids for like chronic pain patients. That there was definitely some things that I didn't see as necessary for some patients, or I thought that some therapies were possibly better than the others. So had some pretty good conversations with physicians, and we weren't even ever collaboratively practicing, but it was just great conversations I had with those prescribers. And then the patients too, I had really awesome conversations. So And I've always really been interested in pain management, even in school. It was always like a side passion. Me and my friend and I, we really looked into pain management and pain management for the athlete specifically. So I've always been really into pain management in addiction medicine. So I already knowing this foundationally that I was interested in this, I wanted more of this kind of interactions with these patients where it wasn't so quick and rushed sometimes, but more I could focus on it and work up my patients and go and see them on daily rounds and have that more of an interaction, either in a clinic setting or an inpatient in the hospital. So that's definitely why I chose to get back into the residency.
Yeah, that's my priority as well as patient contact. And that's why right now I am looking at residency directly after graduation for now. But it's good to see some perspective from people telling me what to do. So, what's been your favorite aspect so far? Like, you've completed both your years now. What did you like the most?
So I would say the most important, the part I enjoyed the most was probably the humbling aspect of everything with the residency. So you look back on it when I was in school, I had, your lecturers come in and they're PGY2s and like infectious disease, or we didn't really have many in pain management palliative care, but you're thinking, wow, this person's a PGY2, very experienced, many years of training. And you definitely get that. But at the same time, it's almost kind of an imposter syndrome too, because you're definitely an expert in the field, but it's also very humbling because you're learning something new every single day. So the kind of people that I work with at UF Health in Jacksonville, I'm working with nurse practitioners, anesthesiologists quite often, a lot of different attendings and surgeons too, a lot of surgery teams, and also other pharmacists as well and nurses on the floor. So you're getting that experience from all these different kind of healthcare disciplines that teach you so many different things and aspects that you wouldn't normally think about, whether it's physical exams or like pushing different drugs. So I think the humbling aspect of everything is that you're never going to know everything, but at the same time, appreciating that and saying like, sometimes I don't know this, or I can look that up for you and get that answer to you. You're not going to forget it the next time around. So that's been probably the most exciting part about residency, especially pain management, is getting to work with all these different disciplines and really getting to hone your craft and really becoming an expert in one specific field. So
Yeah. Could you tell us more about? I know you've been mentioning pain pharmacy and pain management a lot. Could you tell us more about what exactly that's like, or describe a day in the life of what you do every day?
yeah, absolutely. So pain management's a very new field for pharmacy. I would say in the past five years, it's really grown significantly. And there's a couple different aspects that we can do, either in the hospital setting or in the outpatient setting, ambulatory care. What we're doing in the hospital is either stewardship, so a lot of monitoring, and that's more so like when a patient comes in on a long-acting opioid or opioids previously, or we're looking for high risk drugs. Essentially, we're going to make sure that those kind of risks get mitigated when they come into the hospital. We're looking at different reports, whether it's Suboxone, methadone, verification of doses, and that's just from a stewardship standpoint. And also from our more clinical aspect, we're rounding with the teams. I was on surgery trauma teams, or our acute pain service. That's like a service they directly consult us for very complex pain scenarios. And we're rounding with a team of nurse practitioners, anesthesiologists, physicians, and other pharmacists too. So that's like more of the inpatient aspect. So your daily rounding. Also, I would say pain, there's actually a lot of emphasis on psych too. So I mentioned addiction medicine, and we're pretty well trained in addiction medicine at our institution. So we've incorporated a whole lot of stuff for Suboxone for not only opioid use disorder, but also pain management. So a lot of education, I would say, is done in terms of that. So a lot of stewardship and education with a bunch of different staff members, because not everyone is as versed as maybe up in the Northeast, where there's a lot more opioid use disorder training. In like the South, it's really like actually like it's progressing, but it's not exactly where it was at my prior institution. So it's interesting to see these kind of different aspects, but it may be more progressive in certain parts, vice versa. In the outpatient setting, though, it's pretty cool. We get to do a lot of collaborative practicing with our primary care doctors. So it's really a pharmacist-run clinic that we can prescribe collaboratively, like C2s, like non-opioids, and we do a full assessment of the patients when they come in. And it's really like a chronic pain management clinic. So it's a lot of regulatory stuff. So we're doing chronic pain. It's non-malignant pain, because malignant pain kind of goes down a different avenue. But we're doing urine drug screens, workup of these patients, and seeing them in clinic with our own visit with them. So it's really a very progressive area that I would highly encourage people who are interested to really try and pursue, or maybe possibly try and get a rotation if you can in that area.
Yeah, it seems because it's pretty new, it seems like the scope with this would be drastically huge in the future. Where do you see yourself moving from here, like after you finish your PGY2, what's next?
So I signed on to become an opioid a pain stewardship pharmacist at Jackson Memorial Health System in Miami, Florida.
Oh, cool.
And yeah, so I start there in a month or so, and really excited about that. But it's pretty similar to our hospital right now that I just came from. And a lot of our patients, it's similar patient population in a large institution that's academic centered. So academic medical center. So a lot of teaching. If anyone's trying to like look at jobs after residency, we're always looking at if it's an academic medical center, because a lot more teaching aspect gets a lot more focus on teaching. A lot of the rotating medical students and residents wanting to learn too. So I'm excited to go down, look further south in Florida.
Yeah, congrats. That's pretty awesome. How did you move from Providence to Florida? What was that like?
It was really, I always kind of envisioned myself maybe moving down south. I always really liked the weather down south, and I thought I was going to end up in the Carolinas, to be quite honest. And then the opportunity arose where Florida, UF in Jacksonville, it's really a hidden gem for its training. It's not really well known to a lot of people going into residency, and I didn't really know about it until I met my RPD at the actual when we went to match. So it was really or mid-year, excuse me. So I was really an unknown like area, especially Jacksonville, Florida is not like a destination city. And but really at that point, already having my Florida license, it's pretty easy and smooth to just transition down to Miami now. But it's definitely very different than up north, like totally different in a lot of different aspects. Like right now, I'm preparing for a little tropical storm to come through. So it's really, you don't see that up north, and a lot of different pros and cons to each. No winter, but tropical storms, hurricanes. So
Yeah, but nothing's better than the heat or the beaches. At least you got the beaches both ways. So, so now that you moved to Florida, you're still continuing to do retail on the weekends, right?
yep. So I've
So
been still doing. Sorry, what were you gonna say?
I was just gonna say, so tell us why that's important, why you still feel like you want to be connected to the retail setting.
Yeah, so retail has always been something that I've been really passionate about, and I still like those connections and meeting new people. It's really a break, honestly, from residency too sometimes. So I really like working in different settings and not just like solely inpatient, but also getting to like continue those relationships in the outpatient setting. And it's been a grind though, I won't lie, like with residency and part-time, it's helped pay off loans, and it's been really a blessing to actually have that opportunity and like continue that work. So but it's always been something that I want to keep doing, and really always enjoyed those experiences. And retail is definitely hard in different areas, but it's kind of like I said, I look at it as a break from the inpatient setting, and you get to have more of a patient interaction sometimes. So it's really a blessing in disguise.
Do you feel like you have a break at all if you're booked on weekends or weekdays?
Yeah, I'd still take some time to myself. That's definitely been a big aspect of residency is understanding time management. And just like, I know we say that and you'll hear that a lot. It's like, well, my time management got better. Like my goodness, it really does drastically improve. Even from my PGY1 to PGY2, it like in the past year or so, the efficiency's been crazy. But at the same time, like my directors are like, take a day. Like if you need to take time, like make sure you're not only managing your own time with work, but also like caring for your mental health, because that's a huge aspect that we're seeing a lot, at least in healthcare professions now, and with physicians too, like taking time to yourself, going home to see your family, and like taking days. So I'm not working every single weekend. There have been times right when I graduated where I was working so much and doing like overnights at one point and craziness. But now I think I still work quite a bit, but I find time to like get away from work and be with my family and friends. So
Yeah, that's good. I know I'm a workaholic too, and this is summer right now, and it's actually my last summer because next summer we start rotations, and I'm trying to make the most of it, but it's like itching me. I'm like, I need to do something productive. I need to go to work. Like, so I feel that.
yeah, it's a
Yeah.
weird feeling. It's definitely a weird feeling. I wake up anxious every morning now because I would always have meetings and like projects due and assignments and working sometimes on weekends at CVS. So it's like, it's weird not having anything for a little break because I just finished a residency. But yeah, that whole go mentality is definitely not a bad thing, but to slow down sometimes and be with your family and friends is really important.
Yeah, I agree. What's the most challenging part of your job? Like what's hardest? Where areas where you still feel like you need to learn?
So I would say there's a challenging aspect that's okay, so the most challenging aspect I would say is I will be still practicing in the outpatient ambulatory setting for pain management and like palliative care, where the job I'm going to. It's very hard to sometimes have a fine line and balance between patients that they're truly in pain, but at the same time, there's additional substance use disorder. And diversion is a common thing that you really see in this setting and practice in general. So I knew that this was something that I was going to go into, that this would be a big area, but I'm telling you, you get really good at, I swear if I played poker right now, I'd probably be a lot better at reading people because you come into the clinic and you be objective as possible and you want to like absolutely help every single patient, but patients lie to you. Patients lie to you quite often. And we get a lot of drug screens that come back that are positive for different drugs. So it really takes a lot in a person to continually be objective and not subjective with these patients and like throw bias or have like an opinion prior to someone even coming in. That's really difficult for a lot of people. So that's a very difficult aspect of the job. And I think a lot is just through personal experience too. So you get to learn if you've been burned once or twice, like, okay, this can happen, but still treat all patients very fairly. But that's really something that I would say comes with time and experience. And my director is very good at a lot of those aspects and like interpreting different drug screens and like expecting certain things to happen because he's been seeing it for years. So it's something that's very difficult. And I would just say it comes with experience, but something that I didn't really expect to be thrown into a lot before I started this.
Yeah, that sounds pretty intense. How did you know that you wanted to do this? Did you take like a rotation or something? Like, where did the interest in this come from?
So going back to, I think I mentioned it briefly, but a friend and I had a business venture, I think it was Self-Care 2, where we took this class, Self-Care 2, and at URI, still very available.
I just
And yeah,
yeah.
it's a great class. And Dr. Orr does a great job in terms of the business management, the building a project for business. And we crafted a project that was sports pharmacy and the involvement of pain management with the athlete. So this is a huge aspect that I've torn my ACL in previous like injuries in sports, and I hurt and broke my multiple bones in like my hand and my elbow and stuff. So I had a lot of personal injuries myself. And the whole rehab process was really interesting to me and like that of an athlete. So I never played college sports, and like I knew a lot of people that played college sports though too. And I saw it was very demanding on them too. So that was a big aspect as to why I was interested in pain management. Plus, it's a really cool field. Like we kind of talked about it earlier, but a lot of the pioneers are coming out of this field. So it's a lot of like, it's a very small field. So you can get connected with a lot of people in the field because it's so small. Like I'm already like, I'm working with a lot of other like the great directors at my program, but also a lot of directors at other programs because there's really only like about 100 pharmacists like in this field that are very like active and engaged quite often. So I would say it's such a cool field because you're able to do different things and like practice at the top of your license. Like I don't really know many other aspects where you can like prescribe and like do all these kind of different things. And there's a lot of physical exams that are like performed for this kind of field too, which is different and something that I really appreciated because you have to actually inspect the patient too. And like you get the diagnosis obviously from the physician initially, but you're still doing your due diligence and working up the patient and doing physical exams. So those are a lot of reasons that got me into pain management. But yeah, still I have like a side plan of like eventually getting into an area of helping athletes with pain management and now mental health, because that's a big component of what's been going on in our society is the actual like resurgence of now recognizing mental health and recognizing mental health in the athlete too. So it's really cool. And I think eventually I'll try and start like a consulting firm or something on the side for pain management for people in general with collaborative practice or with the athlete specifically. So that's really the end goal probably for me. But definitely what's led up to where I am today.
Yeah, that sounds really interesting, and we don't have a lot of those around. And I think that's a smart business idea as well. So circling it back to URI, how do you feel like the URI staff and faculty sort of prepared you for this role?
I feel the entire URI program was excellent in terms of not only the academic rigor of the program, but also the support system with URI. So it's, as you know, it's a very difficult program. And once you go through it academically, you graduate and you kind of think maybe you won't really be in touch with the program too much. Like you're going to go on and do your own career and stuff. But honestly, the connections you'll make at URI, you're going to keep referring back to those connections and the people and professors that you meet that support you in your endeavors after graduation, which was something that was really new to me because you kind of see that in high school a little bit, but once you get into college, it's like a different aspect of you finish and then someone's helping you continually, like supporting you and writing letters of rec and like really pushing for you. So that's something that was incredible from URI and the support system that I received from a lot of the professors at the institution that was unparalleled to a lot of other universities from what I've seen from other from other people I've talked with. So I feel like very supported and prepared for whatever I'm going to go about doing. I mentioned the self-care 2 class that was business oriented. So I mean, it's not only got the aspect of clinical side to pharmacy, but also the business side to pharmacy too. So I dabbled in possibly looking at an industry fellowship too when I was at URI. So I had all these different interests and the professors could see that and they kind of just like guided me the best they could, like along these different paths and hey, try this, hey, try that, keep doing this, keep doing that. And it really like leads to, that's the best way I can say for a lot of people who are interested in different things, just keep trying different things. Like you're going to be so young when you finish school that you can fail and succeed like many different times. So the actual rebound you'll have from a failure is pretty significant too when you're like so young, you have so many more opportunities. And I think a lot of people don't take that into perspective. So I would say very prepared for the future, excited for the future, but URI definitely helped me foundationally to get to where I am today.
Yeah, that's great advice. I also heard once someone said that even if you go on rotations, even if you don't like it, it's not a failure because now you know what you don't want to do. So it's still like one option that you've ruled out. And yeah, we get so like like structured on like we need to do residency or fellowship, and it's often like the traditional paths that most people take. So if anyone's doing something non-traditional, we like to bring them over here, tell us what it's like, help those of us who need to hear it. So thank you so much for joining us. And then just one last question. What advice do you have to someone who's going through pharmacy school at URI or anywhere else and just, doesn't really know what to do after graduation?
Yeah, so it's tricky when you're coming right out of graduation and you kind of don't know exactly what field you want to go into or specifically within pharmacy. But kind of like we talked about, try different things, keep trying, and if you fail a couple different times, it's okay. Like really keep trying and keep like reaching out to different people. Use LinkedIn, use your connections at URI. Like the amount of job interviews I got off of LinkedIn was pretty incredible because like you can just reach out and reach a large group of people. So you want to keep like trying what you're able to do and like be humble, be really motivated and just show up. A lot of times showing up and like being on time and doing the best you possibly can sets you up for the best opportunity for success. And I think that's really important. And a lot of people don't recognize that in the moment, but daily rituals, daily routines set you up for success in the future. So be optimistic too. I know a lot of people talk about pharmacy and the field of pharmacy is not looking so optimistic. It's really in the eyes of the beholder. So how you look at it, like pharmacy and pain management, for example, it was nothing 5 years ago. And it wasn't really a field like 5 to 10 years ago. It wasn't really developed. So I would just say keep pursuing into different avenues and do what you're passionate about.